My name is Howard. I'll be presenting Team 15's solution today. So I have the privilege for presenting for Kristine, Linn and Lola over there. The title of the talk will be Bike Spirit, Evolving the Danish Biking Culture. So we had Paul's challenge, which was to reduce the prevalence of diabetes by 2025 to 2010. And we were broadly given two options. And when we were thinking and talking about this, we thought the largely positive nature of more of a preventative solution was better than a treatment or management approach. So we've decided to develop a solution around option 2. And because there is no one solution internationally, local solutions is the way forward, we've decided to base ours around Copenhagen, Denmark. So our solution is to increase physical activity broadly among the Danish population by encouraging more bicycle riding. And we really liked this idea, and we think it makes a lot of sense because it's not a concept that needs introduction. It's already heavily embedded in the culture and it's worked. All we think that needs to happen is for it to evolve and for the government to increase its applicability to people. So our target group are people who live in the countryside, who may be less active than those in the city, and to whoever might benefit from more from this particular scheme, which is a park and ride scheme. So this involves the development of large-scale car parks around the perimeter of the city, and this would be replicated across the country. This would allow people like Barry here to drive in from the extra urban areas. To drive in, he would park up. He would get free usage of a bike, which he would then be able to ride in, do a couple of loops of the lakes if he needed or he had time to, and then go to work, and he could repeat that in the afternoon. And we think this makes a lot of sense because it breaks up the day, and the cumulative effect of that has great benefits. But of course, not all inactive people live in the countryside, so and also to try and target the socioeconomic issues here, we've decided implementing electricity-producing bikes at public transport stations could also be worthwhile. So for people who are waiting at bus stations or train stations, they could jump on a bike, do a few kilometres, and perhaps work off the cost or reduce the cost of their transport tickets, or they could use it to charge up any electronic devices. And of course, not all who live in the country need to travel to the city, so we also suggest implementation of home-based electricity-producing bikes for them to increase or encourage physical activity in that group. It would improve the population's quality of life because it increases physical activity, and no one here needs to listen to this list again, but I will say it. It improves body composition, cardiovascular function, musculoskeletal health, psychological health, amongst a whole other cohort of factors, and these act to cumulatively reduce or decrease the risk of cardiometabolic diseases, and this obviously is inclusive of diabetes, but also atherosclerotic cardiovascular disease, cancers, dementia. So it works to extend life, but also improve the quality of life. So it casts a broad net, which obviously is pretty important as well. Our solution is intuitive and easy to understand because it's like riding a bike. It is just that. It's quite easy. A lot of people know already how to do it. And as I mentioned earlier, it's embedded in the culture. But we think it's easy for people to understand, and they'll understand the benefits of it because everyone gets frustrated in traffic. So it'll decrease time spent in traffic congestion, decreases the stress and expense of finding parking in Copenhagen and all the major cities. And it can also offer people within cities free transport tickets or other little bonuses there. Our solution is cost effective because car parks are not expensive compared to other infrastructure projects, and they're not expensive to maintain either. Bikes are not expensive either, and I think 16,000 bikes are collected nationwide each year that are abandoned and just left around, so they can be refurbished and entered into the scheme. And biking infrastructure is it's world renowned in Scandinavia and also in Denmark, so there wouldn't need to be much work done there. Perhaps most importantly though, interventions that bring 1/5 of currently inactive Europeans up to the recommended activity would yield benefits worth up to 16 billion for the EU. This figure obviously isn't as large for Denmark, but it'd still be very substantial, and that could be used to subsidise the implementation of our schemes. We have definitely thought about this, but we still think that it benefits from minimal ethical, legal and regulatory issues because it is quite uncomplicated. And I think importantly our solution is a carrot, it's not a stick. So that, I think that in itself takes out quite a lot of ethical issues because we're not enforcing things, we're not punishing people for not taking part in it, we're simply trying to positively and gently persuade people to take different daily routines and different courses of actions. So for people like the elderly or people who are injured, they can still drive in as they otherwise did, but there's definitely benefits in doing the opposite. Why should we win? So as I've explained, we don't believe whole-scale changes are necessary or reinventing the wheel is necessary to overcome this particular health issue. Scandinavia's led the way in the biking culture, and I think just tweaking of that and progressing that would be very beneficial. It's logical, everyone needs to commute from A to B. More people doing that on bikes than cars is obviously better. And if you can help people to do that, then it's only benefits everyone. It's feasible, it's cost effective in the long run. It's based on an already strong biking culture in Denmark, and it can be quickly implemented in other countries if it works out quite well. And most importantly, obviously, it's healthy and environmentally friendly. So that was our talk. Thank you for listening.